Well, South Korea's largest lobby group for community doctors has threatened an indefinite walkout from next Thursday unless the government accepts its demands.
정부는 전공의들을, 이 땅의 모든 의사들을 노예가 아니라 생명을 살리는 전문가로 존중하고 전문가의 목소리에 귀를 기울여야 합니다.
Those remarks delivered by the head of the Korea Medical Association at a rally earlier today, which saw some 10,000 community doctors staging a one-day walkout in protest at government plans for healthcare reform. The KMA has demands, and these include revisiting the issue of increasing medical school admissions, as well as withdrawing all punitive steps against trainee doctors who have stayed off work since late February. More than 1,400 private clinics and professors from 40 medical schools joined the collective action today. A move that President Yun Suk has described as regretful and disappointing. A return to work order was also made by the government today, warning that protesters could face legal punishment. CNA's Lim Yun Suk tells us that despite the growing labor action, public support is behind the government's plan to increase the number of doctors.
South Korea has seen rallies and strikes by its doctors in the past. They usually go back to their jobs after making their voices heard. But it's been 4 months since more than 9,000 junior and trainee doctors left the hospitals over the government's plans to sharply increase medical school admissions. And now other doctors are taking action.
우리 후배인 전공의 의대생들이 시작하고 유지해온 투쟁이지만 이제는 의협을 중심으로 선배 의사들이 이 사태를 바로 잡아야 합니다. 더 이상 끌 수 없는 상황입니다.
Speaking to CNA, KMA's deputy spokesman Choi Dong-young says the one-day strike could be just the beginning.
지금 저희가 말씀드린 건 일단은 18일 하루 휴진이지만 그 휴진을 시작으로 저희가 정부가 뭔가 대화에 전혀 의지가 없고 앞으로도 바뀔 그런 계획이 없으면 전공의 선생님들이 들어올 이유가 없기 때문에 저희는 앞으로도 투쟁을 이어나갈 거고 그 형태는 지금보다 수위를 더 올리는 형태로 아마 진행이 될 것 같습니다.
Doctors argue that the government's plan to increase the number of medical students will not solve the fundamental problems facing the healthcare system. These include a lack of specialists in some fields like pediatrics, where conditions and pay are poor compared to other specialists. The walkout by the junior and trainee doctors has crippled South Korean hospitals. Medical students have also either delayed their enrollment or boycotted classes in support with the junior doctors, saying the government's plan, if it goes ahead, will affect their careers as doctors once they graduate. Ashley Kim, who graduated from a nursing school in February, says she was offered a job as a nurse at one of South Korea's largest hospitals. But the hospital has not told her when to start, as hospitals are delaying new hires due to the ongoing walkout by doctors.
저는 작년에 합격을 한 상태인데 지금 의사 파업과 여러 가지 이유로 계속 입사가 미뤄지고 있는 상황이에요. 놀 때는 약간 좋았는데 이게 계속 언제 들어갈지 모르는 상황에서 있다 보니까 계속 초조하고.
She is hoping that the doctors will return to work soon because their job, like for nurses, is to treat patients. That sentiment is shared by the majority of South Koreans, who also say more doctors are needed in the country. Lim Yun Suk, CNA, Seoul.